So today we are going to discuss a case study. Okay. So assume that there is a 20-year-old football player. He has got injury while playing football. Okay. So his mechanism of injury is while he is playing football, he got a sudden twisting movement and that leads to the knee injury. Okay. So at that time he had a sudden pop sound. Okay. So what do you think about this? ACL injury. It can be ACL injury. What are the other structures that can get injured when your knee is getting injured? Meniscus, PCL, MCL, LCL. Okay. If there is a pop sound, indicates what? It indicates ACL injury. But when there is a locking, if your knee is getting locked, that indicates what? You have a meniscal injury. Okay. So when you're after knee injury, if your knee is getting locked, that means you have a meniscal injury. After the injury, you get a pop sound, that means you have a ACL injury. Okay. So after that 2 hours, what he got is his knee got swelling. Okay. So around the knee there is joint effusion. Okay. So I will divide you into 1 group and 1 group. Okay. So this team, please tell me what you need to do if you get swelling, and this team, please tell me what you need to avoid while you get a injury. You are getting ACL injury. What are the activities you should avoid? So after you get swelling, how you will manage? What you can do? Please tell me.
Hot pack.
Hot pack. Then elevation, compression, icing. Okay. So you can follow the RICE protocol. You can give the rest, then you can give icing, then you can give the compression and elevation. So that the joint effusion, the swelling around the knee joint will be reduced. So this is the immediate management while you can do joint effusion. Okay. So what are the things you need to avoid? What are the activities you need to avoid if you get an injury? Like if you are doing twisting activities, squatting activities, like that activities, what activities you can avoid? Jumping, you should not do jumping. Then we can't do squatting, then pivoting. Exactly, we can't do pivoting, squatting and jumping activities. Okay, so these are the things we need to avoid during that stage. Okay, so after he is getting, you see he is having swelling. So during the swelling, what are the other things associated with the swelling you need to check? Warmth, redness. Okay, so if there is warmth and redness, what is that indicating? If there is warmth and redness in that swelling area, what is that indicating? Infection. Exactly, if there is infection inside the joint only, you will be having warmth and redness. Otherwise, the joint will be okay, only swelling will be there. Okay, so if there is infection, immediately we need to consult the doctor and we need to take the medications. Okay, so after this you have doing the management. What are the other things you need to do during the management? You are the physiotherapist, so what are the other things you can do? Special tests. Okay, so in special tests, what are the basic special tests you can do for ACL injury? Latchman test, then another test, anterior drawer test, valgus test. Okay, so which is the most sensitive test you can see in ACL injury? Which is the most sensitive? Among these 3 special tests, which is the most sensitive test? Latchman. Because why? Because in that knee is only need to flex to 30 degree. In anterior drawer test, you need to flex the knee to 90 degree. All the patient cannot flex the knee to 90 degree because of the pain. So the most sensitive test, the most first basic test you can do is Latchman test. Okay, so if you can't do anterior drawer, you can go with the Latchman test. Okay, so you guys know how to do that? How to do that? What is the position of the patient? Supine lying. How should be the knee? where the patient, therapist need to hold the patient. One of the hand should be over the anterior aspect of the tibia, other hand over the femur. And what movement you need to do? You need to anteriorly translate the tibia. If the anterior translation is more than 5 mm, that indicates your ligament is tear. You have ACL tear. The same way for PCL, you need to do the posterior translation. Okay, posterior translation is the that indicates you have PCL tear. Okay, so after this, you got the special test. You are doing the management joint diffusion. What is the other thing you need to attain?
Grade.
What?
Grade.
Grade. Okay. So what is the grade? Grade 1, grade 2, grade 3, grade 4. Okay. So if it is having a minimal grade, what management you can do, and what management if you have a grade 4 and 1? If you have a grade 1, what you can do? Conservative management. You can go with rest, elevation, compression and general isometrics. If it is having a complete tear, okay, it is not partial, it is complete tear, what management you can do? You need to do ACL reconstruction surgery, and after that you need to do the post-op. Okay. So this is all about the ACL injury case. Hope you guys understood about this. Is there any doubts? No. Thank you.
Thank you, ma'am.